Hello, I'm Erin Lindberg, a holistic and women's health occupational therapist with Integrative Therapies and Wellness. Today I'm going to talk about three-dimensional breathing. Breathing is a fundamental moving pattern and one we do more than any other movement in life. Therefore, it's important that we're doing it correctly. There's many benefits of three-dimensional breathing. It calms the nervous system, bringing the autonomic nervous system into balance, creating relaxation. It brings a gentle massage to our abdominal organs, aiding in digestion and lymphatic drainage. It manages pressure of our core and our pelvic floor. It activates our deep core, stabilizing our pelvis and our spine. It releases tension through our neck, back, and shoulders. And it's a corrective exercise for postural alignment and hip and shoulder conditioning. Today, many of our jobs and lifestyles are more sedentary due to modern technology, and high stress is more prevalent on a daily basis. And this takes a toll on our posture and breathing patterns. Poor posture impacts our body's ability to access the biggest breathing muscle, which is the diaphragm. And this may cause breathing dysfunction, but also back and neck pain, as well as joint dysfunction and anxiety. I'm going to talk about two common breathing patterns you've probably heard of. One is chest breathing, the other is belly breathing. And chest breathing is where we take more quick, shallow breaths, just taking in minimal air, usually just in the upper part of our body, where our chest just rises up towards our ears and back. And when we do this type of breathing, chest breathing or shallow breathing, we're using our secondary breathing muscles, which are on the front of our neck and our chest and our upper back. So our upper traps, our sternocleidomastoids, our scalenes, our pectoral muscles, kind of around the clavicle region, our collarbone. And when we use these muscles over time, we can create overuse, and which can develop tension throughout our neck, shoulders, and our thoracic spine. And the reason we get tension through the thoracic spine is because those ribs aren't moving like they should. So those joints on the spine that should be moving become stiff, and we start to develop pain there. It also affects our posture. We start to get forward and round in posture and forward head because all the muscles through the front are tight and pulling things forward. And this can create back weakness. And it also can create a rounding of the back, which is called kyphosis. And with this postural change and the muscle tension, it can develop neck pain, shoulder dysfunction, mid-back pain, headaches, numbness into the upper extremities. Air takes the path of least resistance. So if we have a slumped posture, or if we are chronic abdominal grippers, some people have overdeveloped abdominal muscles, therefore they have a tough time letting go or relaxing them. Some people just chronically hold in their tummy for vanity purposes. And this type of patterning creates a path of least resistance, so when you breathe, then automatically that breath is going to come up versus allowing the diaphragm to come down. So it promotes chest breathing. Not only that, but chest breathing stimulates the fight or flight response and increases the stress hormone cortisol. Belly breathing, on the other hand, which is better but still incomplete, when we belly breathe, we breathe only through the tummy. So all the air is coming this way and down. And this increases intra-abdominal pressure. So there's a lot of pressure on the anterior, the front fascia. So if you have a separation in that fascia or a diastasis recti, this type of breathing can prevent healing in that area, or even if you have an abdominal incision or a hernia. It also can put a lot of pressure on the pelvic floor. So if you have a weak pelvic floor, you are more prone to prolapse, pelvic organ prolapse, or incontinence issues. As well as in chest breathing, in belly breathing, you don't get a lot of rib expansion. So again, you can develop that mid-back tension and stiffness because those rib joints are not moving. It also, if your abdominal muscles are weak and your chest cavity is tight, this creates a path of least resistance in the belly. So if you've got that going on, then that's the path that you're going to develop belly breathing because of that weakness. And a muscle needs to first lengthen in order to get a good contraction. And when we belly breathe, the only abdominal muscle that's getting lengthening is that rectus abdominis in the front. And we don't get the lengthening through the sides of our abdominals, so those obliques and those sides of the transverse abdominis and in the back of the transverse abdominis. That transverse abdominis is a corset muscle that wraps all the way around, and then our obliques are on the sides of our abdominals. And we want to make sure those are getting lengthened as well, because we need that eccentric strength of that transverse abdominis and those obliques in order to get good rib expansion and also to get good core stability. So if we're only belly breathing, we're never able to sustain that correct core tension to perform exercises that need that lumbo, so that lumbar and pelvic stabilization or stability. So this can be a common issue with people who have tight piriformis, so the butt muscles, or the back of their thighs or hamstrings, or low back tension, or complain of SI pain after exercise. You may have a breathing dysfunction. Also, tight muscles on the side of your torso or your abdominals can create pressure this way, pushing your abdominal tissue kind of forward, creating some distension through that tummy, or a protruding, or that kind of, I call it a pooch that we all are desperately trying to get rid of. So that's chest breathing and belly breathing. And now I'm going to talk about what I consider correct breathing, which is a little both, but also more a three-dimensional expansion. So that's why I call it 3D breathing. So we want 360-degree expansion of our ribs and torso. So we want expansion all the way around through our ribs and our torso. So you're going to have a little bit of chest and a little bit of tummy movement and a lot of rib movement. And what this does is it equally disperses the pressure. So not all the pressure is coming here, not all the pressure is coming up, and not all the pressure is coming down. It's equally distributed all the way around. Therefore, you're getting good muscle distribution and not having overcompensation of other muscles. So when you inhale, you're activating that diaphragm. The diaphragm's coming down, it's pulling down, those lungs are filling, you're getting a slight inner core contraction, so those ribs are expanding, so that torso is filling up like a balloon in all directions. So those ribs are expanding to the side, to the front, and to the back. So those joints at the sternum and in the spine, those ribs are moving like bucket handles, so you're getting good joint mobility with every breath, and you're having equal belly and chest motion. You're getting spinal lengthening, and your torso is straightening, so you're getting some core stability and postural restoration during each breath. And on the exhale, that diaphragm is relaxing, coming back up, forcing that air out. Not only do you get good core activation, but the bottom of your core is your pelvic floor. And when you inhale, you get a little descent, slight pressure down of those organs, which triggers the pelvic floor on the exhale to gently contract, giving you support from the bottom of your core. So now I'm going to demonstrate the three-dimensional breathing so you can practice that at home, because the more that you can practice the breathing fundamentally and change the fundamentals of it, it'll carry over in your dynamic motion day to day. So I'm going to show you laying down. And to get good breathing, it's important to have good posture when you're practicing. So sometimes people are rib thrusters, where they kind of thrust their ribs out and their head kind of pulls back, their chin and head, neck pull back into an extension. So it helps if you put a small towel underneath your head just to kind of bring your chin down a little bit, creating more alignment between your neck, your thoracic and your lumbar spine, and your thoracic, your abdominal, and your pelvic cavities. You also want to make sure your pelvis is neutral. You don't want your pelvis tipping back and your lumbar spine pushing down into the table. You want to make sure your pelvis is neutral. One way you can line it up is putting your thumb on your lower ribs and your middle finger on your pelvis, and just make sure they're kind of lined up, that one isn't tipping back or one isn't thrusted forward. Also, to help with pelvis and abdominal alignment is to put a ball under your legs so you get a 90-degree angle at your knees and at your hips. You can also lay on the floor and put your legs up on a chair or a couch to create this similar alignment. So now that I'm all lined up, when you take a three-dimensional breath, remember you're expanding those you're gonna fill the air into those lower lungs, taking up that full lung capacity, expanding those ribs front to the side and to the back. Your chest and your belly should move equally. Your belly kind of comes along for the ride. You're not puffing your belly up and you're not raising your chest. So the first thing I want you to do is lay your hand on your chest and lay one on your belly. And I want you to do a three-dimensional breath where you're taking the air in through your nose for roughly a count of 4, and then holding it for just a count, and then exhaling slowly either through your nose or your mouth, allowing that diaphragm to relax. So you're going to inhale, and exhale. And hopefully you notice that either on yourself or watching me, that my chest hand and my tummy hand, one didn't move significantly more than the other. They kind of moved equally together. Second, I want you to take your hands and you put them on the sides of your lower ribs. Your fingers are on the front of your ribs, your thumbs are on the back of your ribs, and most of your ribs is right in the middle here. And I want you to feel expansion through all parts of your hands. So hands are on those lower ribs, and you're going to inhale, and I just want you to pay attention at the ribs moving to the back and to the sides. A lot of people are used to breathing through the front, and I want you to get used to breathing out to the side and into the back. So you can even feel how your ribs kind of push back down into the mat, the table, the floor, whatever you're laying on, or if you're sitting into the chair. So you're going to take a deep breath in, and exhale. And inhale. And exhale. And just notice how my hands are moving out to the side. Inhale. And exhale. If you feel tight and it's hard to expand to the side and the back, just give it a little breath hold at the top of your inhale to just give it a little bit of a gentle stretch. And then when you exhale, you're allowing the diaphragm to fully relax, getting all the air out. You don't want to overly grip your abdominal muscles to force it out. You want it to be more of a relaxation process. So the biggest barrier to, the biggest barrier to the three-dimensional breathing can be that you're tight and you have difficulty expanding your ribs or your torso to the side and to the back. And that's where I have another video attached on a couple exercises that can help you with that. So improving your breathing mechanics will help you take deep breaths during daily dynamic activities and exercising, also controlling your heart rate and supporting optimal posture. Correct breathing not only provides stability, but it also leaves your neck and back feeling amazing. So it will also provide you a level of new core strength as well as stress relief. So happy breathing.